Howdy there, it's Eric Backer, naturopath from New Zealand, author of Candida Crusher, formulator of the Canzia range of products. Question I get asked by many subscribers on my YouTube channel is, Eric, can you do some YouTube videos on ear problems and Candida? And I can do that indeed. I'm going to do one video now on ear infections and yeast infections, Candida infections, and I'll do a subsequent one on tinnitus or noises in the ear and Candida, because there's a link there as well. But ear problems, ear infections are something that I've worked with now for many years with patients. So it's estimated that between 80 to 85% of all children are going to have at least one ear infection before the age of 3. It's very common. And in fact, over 30% of all visits to the pediatrician involve an ear infection. And of course, what is the thing that they will give a child with an ear infection? Antibiotics. What a stupid thing to do. In 2010, the Journal of the American Medical Association released a report saying that antibiotics were ineffective for ear infections in infants, and in fact that they've discovered that they cause a huge big problem with the beneficial bacteria. So once you get caught in the antibiotic loop, in that merry-go-round, you'll find that you'll be forever going back for more drugs and more drugs and more drugs. Poor children who get antibiotics before the age, especially age of 1 or 2, create a massive amount of problems for themselves as they get older. It's critical that the child maintains a very, very good microbiota in their gut. They need to keep the bowel flora intact. It's critical, because that's going to really help them protect their body from a lot of illnesses as they grow into teens and then young adults and then into adulthood. So it's the foundation. It's really like when you build a building, you need to have a very good foundation before you build a superstructure on top. The gut is the foundation. So if you're going to come in there and mess all that foundation up, even before the building's put up, what's going to happen when that building is 20 stories high, when that child is 6 foot tall? And what's going to happen when a strong wind comes along? That whole building's going to go. Okay, so when that child is older and 6 foot tall and gets some kind of viral infection, or goes through a marriage bust up, or has some massive stress in their life and then gets put on medications, they're going to get very sick. So it's not a good idea to mess around with the foundation. Better off messing with the foundation when the building's well established, But so be careful with that. That's good advice to you if you've got children, young children, and you're watching this. It's your call if you give antibiotics, but I just think it's a crazy thing to do for ear infections. There are certainly different ways around treating them. So the link is certainly there. Candida causes a huge amount of disruption in a person's body on multiple levels. Candida loves to affect different areas of the ear, nose, or throat. It can be easily identified in infants with strong sugar cravings, white-coated tongue, erratic behavior, very strong liking for one particular kind of food. Allergies are something that you'll find typically associated with ear infection, very much so. If you've got a child with a very powerful liking for a particular food, you need to get rid of that food out of the child's diet, because that can often be the food that's helping to stimulate the allergy, whether it's oranges or bananas or cheese. It'll often be a key food. If you look at the page in my Candida Crusher book called the Hypoallergenic Diet, or the Low Allergy Diet, it's the second phase of my Candida diet approach. That's the kind of diet sheet that you want to look at when it comes to your child and ear infections. So the key foods that you want to remove from that child's diet will be all dairy products. Butter is fine, but you want to take cheese out, and milk and cream. Yogurt is generally okay, unless there's a very powerful allergy, then you want to take yogurt out as well. Oranges and bananas you need to take out of the diet. Chocolate. All forms of sugar need to go from the diet with ear infection. All forms of sugar, including honey, maple syrup, molasses, xylitol, stevia, brown sugar, any kind of sweetening agent, you need to just pull it out. White sugars especially. High fructose corn syrup, which is buried in so many foods today. You're going to create a suppressive effect of the white blood cells, and you're going to create a stimulation of the candida. So it's a double-edged sword there, double whammy you're going to create when you give sugar to a child with an ear infection. If you want a quick resolution, my suggestion, especially with a young baby or a young child, is to go to your herbalist and get some drops for the ear. I quite like using onion juice. So get a brown onion, cut the top off, and that juice into the ear. That has a very good effect on ear infections. There are different herbal solutions that, again, your herbalist can make up for a child, but the big one is you need to make that diet change. Making that diet change will help. Antibiotics, I wouldn't even go there. I just don't think it's a good choice at all. I think it's a waste of time. I found cow's milk to be the biggest one with ear infections. So take the cow's milk out of the diet right away. See how you go. Thanks for tuning in.